Ivermectin is a medication primarily known for its anti-parasitic properties. Initially introduced as a veterinary drug, ivermectin quickly garnered attention for its effectiveness in combating parasites in livestock. Its success in animals led to its exploration for human use. Today, ivermectin is recognized by the World Health Organization as an essential medicine for certain parasitic infections in humans. Ivermectin is available in both oral and topical formulations. The oral form, typically taken as a tablet, is used for treating internal parasitic infections. The topical form, available as a cream or lotion, is effective for external parasitic infestations, such as head lice. Ivermectin's mechanism of action involves paralyzing and killing parasites. It does this by interfering with the nervous system of the parasite, ultimately leading to its demise. This targeted action makes ivermectin generally safe for human use when taken as directed by a healthcare professional. While ivermectin has proven invaluable for treating specific parasitic infections, it is crucial to remember that it is a prescription medication and should only be used under the guidance of a healthcare provider. Self-treating with ivermectin, especially with formulations intended for animals, can lead to serious health complications. Ivermectin has received approval from the U.S. Food and Drug Administration for treating specific parasitic infections in humans. These include onchocerciasis, also known as river blindness, a debilitating disease caused by parasitic worms. Ivermectin effectively targets the larvae of these worms, preventing further damage and slowing the progression of the disease. Another condition effectively treated with ivermectin is intestinal strongyloidiasis. This infection, caused by parasitic roundworms residing in the intestines, can lead to a range of gastrointestinal issues. Ivermectin works by eliminating these worms, providing relief from the often debilitating symptoms of strongyloidiasis. In addition to these conditions, ivermectin is also FDA approved for treating other parasitic infestations, including head lice and scabies. Head lice, a common problem particularly among children, can be effectively addressed with topical ivermectin formulations. Scabies, a contagious skin condition caused by mites, also responds well to treatment with ivermectin cream. It's important to note that while ivermectin has demonstrated effectiveness against these specific parasites, it is not a broad-spectrum anti-parasitic. Its use should be limited to the conditions for which it is approved, and always under the supervision of a healthcare professional. The COVID-19 pandemic sparked a wave of research, with ivermectin emerging as a point of interest. Early studies suggested antiviral properties, but misinformation spread. The FDA has not approved ivermectin for COVID-19 treatment. Laboratory findings haven't been replicated in large clinical trials. The WHO and NIH state there's insufficient evidence to recommend ivermectin. Misusing ivermectin can lead to serious health risks. Rely on credible sources and follow healthcare professionals' guidance. When prescribed ivermectin, it is essential to follow the healthcare provider's instructions carefully. The dosage and duration of treatment will vary depending on the specific condition being addressed, as well as factors like age and weight. Ivermectin is typically taken on an empty stomach, either 1 hour before or 2 hours after a meal, with a full glass of water. This helps to ensure optimal absorption of the medication. It's crucial to avoid consuming alcohol while taking ivermectin, as it can increase the risk of side effects. Before initiating ivermectin treatment, inform your doctor about any pre-existing medical conditions, including liver or kidney disease, HIV/AIDS, or any other condition that may compromise the immune system. Pregnant or breastfeeding women should consult with their doctor before taking ivermectin, as its safety during pregnancy and lactation has not been definitively established. Remember, ivermectin is a powerful medication and should only be used under the guidance of a healthcare professional. Self-treating with ivermectin, especially with formulations intended for animals, can have severe consequences. Section 5. Understanding potential risks and side effects. Like all medications, ivermectin can cause side effects. Most side effects are mild and temporary, resolving on their own without the need for medical intervention. However, it's essential to be aware of both common and more serious potential side effects. Common side effects of ivermectin include headache, dizziness, nausea, vomiting, diarrhea, abdominal pain, loss of appetite, and weakness. These side effects are usually mild and tend to subside as the body adjusts to the medication. If these side effects persist or worsen, it is essential to consult with a healthcare professional. More serious side effects, while less common, can occur and require immediate medical attention. These include vision problems such as blurred vision or loss of vision, seizures, loss of coordination, confusion, severe skin rash, and difficulty breathing. Experiencing any of these symptoms warrants immediate contact with a healthcare provider or emergency services. It's important to remember that this is not an exhaustive list of potential side effects. Always consult with a healthcare professional for personalized medical advice and information regarding potential risks associated with ivermectin use. Section 6. Navigating dosage guidelines. The appropriate dosage of ivermectin is determined by the specific condition being treated, as well as factors like the patient's weight and overall health. It is crucial to follow the healthcare provider's instructions meticulously and avoid self-medicating with ivermectin. For onchocerciasis, the typical dosage of ivermectin is based on body weight and is usually administered as a single dose repeated every 6 to 12 months. The exact dosage and frequency will be determined by the healthcare provider based on the severity of the infection. Treatment for intestinal strongyloidiasis usually involves a higher dose of ivermectin compared to onchocerciasis. The medication is typically taken as a single dose or over several days. Again, the precise dosage and duration will be determined by the healthcare professional. It is crucial to note that using ivermectin for unapproved purposes, such as COVID-19, can lead to dangerous overdoses. Following dosage guidelines provided by a healthcare professional for approved conditions is paramount for ensuring safe and effective treatment. Section 7. Recognizing and addressing overdose. Ivermectin overdose can occur if the medication is taken in excessive amounts or for unapproved purposes. It is crucial to be aware of the signs and symptoms of overdose and seek immediate medical attention if an overdose is suspected. Symptoms of ivermectin overdose may include severe nausea, vomiting, diarrhea, abdominal pain, dizziness, confusion, drowsiness, seizures, loss of coordination, vision problems, and difficulty breathing. In severe cases, ivermectin overdose can lead to coma and even death. If you suspect an ivermectin overdose, do not hesitate to seek immediate medical attention. Call emergency services or proceed to the nearest emergency room. Timely medical intervention is crucial in managing ivermectin overdose and preventing potentially life-threatening complications. Prevention is key when it comes to ivermectin overdose. Always store ivermectin out of reach of children and pets and never share your medication with others. Following dosage guidelines provided by a healthcare professional is paramount in preventing accidental overdose. Section 8. Potential drug interactions. Ivermectin can interact with other medications, potentially leading to adverse reactions or reduced effectiveness of one or more drugs. It is crucial to inform your doctor about all medications you are currently taking, including prescription drugs, over-the-counter medications, vitamins, and herbal supplements. Certain medications, such as blood thinners like warfarin, can interact with ivermectin, increasing the risk of bleeding. Other drugs, such as benzodiazepines like diazepam, can interact with ivermectin, potentially leading to excessive drowsiness and sedation. It's important to note that this is not an exhaustive list of potential drug interactions. Always consult with a healthcare professional or pharmacist to discuss potential interactions with ivermectin based on your individual medication regimen. Open communication with your healthcare provider is essential for ensuring safe and effective medication management. Section 9. Conclusion. Seeking professional guidance. Ivermectin is a valuable medication for treating specific parasitic infections in humans when used as directed by a healthcare professional. However, it is not a cure-all and should not be used for unapproved purposes such as treating COVID-19 without clear evidence from well-designed clinical trials. Misusing ivermectin can lead to serious health consequences, including overdose and potentially life-threatening complications. It is crucial to rely on credible sources of information, follow the guidance of healthcare professionals, and avoid self-treating with ivermectin. If you have concerns about parasitic infections or any other health condition, consult with a healthcare professional for accurate diagnosis and appropriate treatment options. Remember, your health is paramount, and seeking professional medical advice is always the safest and most responsible course of action. Love our informational content? Just like, share and subscribe to our YouTube channel Cal Wayne Health TV for more videos and information on the description box.